Another frequent question asked when treating pain is whether this pain should be tolerated. Like, it is normal to be patient at some point. The pain will go away. Everything will be fine. You do not need to take pills. Basically, such dilemma often occurs. In fact, if there is a serious source of pain, for example, if a person has undergone surgery or has some kind of trauma, the pain is also an important component of the sickness, an important component of this whole pathological condition. And that pain necessarily needs to be controlled and treated. It is important to free a person from pain. Everyone knows if there is any trauma, an ambulance comes. That means it is very important to relieve the patient with a severe trauma because the pain is a component of traumatic shock. And if a person is not adequately pain relieved, that is a rather critical, life-threatening condition for them. Therefore, it is always important to manage pain when there is an injury. Another example of why pain needs to be treated. Let's say a person had a scheduled surgery. Everything went well. Under anesthesia, he did not feel any pain. He woke up after the surgery. The surgeon checked him out, said everything is fine, the surgery went well, everything is under control. Everyone is happy and satisfied and parted ways, but after 6 to 8 hours, the effect of these drugs for anesthesia is over and the patient begins to feel pain. At first, the pain may not be very strong, then the pain is getting worse. Basically, it is important to avoid this. Why? Because there is a lot of research and already a lot of strong experience that when in the post-operative period, let's say the patient is not pain-free enough, his body begins to react to stress, begins to produce various bioactive substances that affect the microcirculation, the immune system, and eventually the healing. The recovery after surgery goes more difficult. The risk of complications that he will have some pus formation and it will take longer to heal in present. That's why a lot of importance is given to ensure that the patient is not experiencing pain. There is such a thing as analgesia. In fact, there is no need to wait for patient to start feeling pain, but to systematically estimate and anticipate the effect of medications and ensure that the patient will not have gaps in pain treatment when the effect of medication has already ended and pain begins to occur. It's all proven, verified by a large number of patients and studies, and it's basically the kind of truth that does not need proof anymore. That's why pain treatment has such an important role. If you take those situations where there's nothing so extraordinary, no surgery, no severe trauma, but there's some problem in the body that's causing constant pain. Most often, somewhere between 25% and 40% of the population, depending on the countries and also on the age group, they experience back pain problems. As a rule, it is a low back pain, pain in the lumbar, back, radiculopathy, sciatica, back pain that extends, goes all the way down the leg to the foot. Sometimes leg pain is even greater than the back pain. And that kind of pain is considered to be destructive to the body. Basically, radiculopathy causes secondary changes in the brain, disruptive sleep, disruption of person's ability to concentrate, for example, at work, because the patient is sitting all the time and thinking, now I'm going to turn around uncomfortably and it's going to make me feel worse. I've been sitting for a long time and I can't be in this position. Even some patients are afraid to sneeze or something because they know that it can provoke such an attack of pain and then it will be bad for hours. In fact, such pain limits the person's activity and productivity. Naturally, the person can no longer perform the task he has to do at work or somewhere else, driving a car or doing family matters. All the time, the person is sitting with caution, scanning through his body, worrying that something might happen. On the other hand, this kind of pain continues during sleep, meaning it becomes difficult to fall asleep. The sleep is superficial, nocturnal awakenings occur, the brain does not rest, which leads to the fact that the person becomes literally exhausted from the insomnia, from the pain. And that is happening constantly, 24/7, and practically drains you out, that constant presence of the pain. First insomnia, and as a rule, then the mental state also changes. Depression appears, as well as irritability. Therefore, the pain including back pain, radiculopathy, must be treated before these secondary changes are formed and the brain already loops these impulses in the central nervous system, making it very difficult to get rid of them. Even if a person has undergone surgery and solved the problem, he still feels pain for some time, and his brain still drives these impulses as if in a closed circle. That is why it is believed that the problem of acute pain, when appears, must be resolved within 3 months. After 3 months, secondary changes have already appeared. Looping of impulses, mechanisms of chronic pain have formed, which is harder to treat and more difficult to cure.